Hello there. Are you a spiritual healer or energy worker who's looking to learn more to broaden your practice? Maybe you're a spiritual seeker, trying to learn everything you can about the world of energy. Perhaps you're new to this whole thing and you're just trying to find out how everything really works. Maybe you've encountered some other energy workers who are a little too woo-woo for you to take seriously. And what you're trying to do is find the straight goods on how it's all done without all that touchy-feely, mystical language that kind of gives us all a bad rap. Well, in that case, you've come to the right place. Welcome to my show, Spirituality Meets Science. My name is Renu Arora, and I'm a practitioner of the accelerated release technique. What's that? I help people overcome mental, spiritual, emotional, and even physical problems by getting to the underlying root cause that's stuck in their subconscious and releasing it. Once that's done, the problem goes away, and to my clients, that looks and feels like magic. But like any good magic trick, once you understand how it's done, you realize that there's nothing actually mystical or mysterious about it at all. And in fact, if with a little bit of knowledge and understanding, you can learn to do that same magic for yourself. So why am I here? I am here to show you that to make energy work understandable and accessible to everyone. I want to show you that this is not just for those rare few born with that natural intuitive insight into how it's all done. So if you're ready to be empowered with new knowledge and understanding of how the world of energy really operates, then I'm thrilled to introduce you to today's topic. So today we are discussing Bowen Therapy. That is it's another form of energy work. It's manual therapy, but has an energy component. And so that alone is pretty cool. That's pretty awesome in my books. And a lot of people use it for pain management, at least in my experience so far. But I'm going to leave that to my guest to talk a little bit more about that. I'm not going to give too much away. Before I continue, I just want to thank all the viewers who are coming here to see the show. I really appreciate you taking the time out of your day to come and visit us and hear what we have to say. And those of you who've been following the show for however long, again, I really appreciate your continued support, as do all the energy workers who have come here to speak out on this fascinating world that we live in. So this is a little different format from the way we usually do it. It's usually live, but this time we had some technical difficulties, so this one's recorded. So sadly, no chat box, but hopefully we'll be able to cover all your questions, anything you might want to ask during the course of the show. So today, let's talk about my today's guest. We have Monique Bourgeois with me. Let me tell you a little about her. Monique helps people get relief from aches, pains, and other issues that they have had for years. She does this by using Bowen Therapy, a gentle, natural, and extremely relaxing body therapy as a certified Bowen Health therapist, though her passion truly lies with empowering her clients to be able to heal themselves. So thank you so much, Monique, for doing this a third time. We've had so many technical difficulties, but we are powering through and making this show happen regardless. So thank you so much for your patience and your sense of humor in this whole crazy nonsense we're dealing with. And please tell everybody about yourself. Tell us where you're from, and bring us in. How did you get into this?
Yeah, thank you so much for sticking with me too. We'll get through this together. Thank you so much for having me on the show, because I really appreciate the opportunity to share about Bowen Therapy. It's one of those things that it's such a wonderful, wonderful modality, and yet not many people know about it yet. Even though it's been around quite a while. So, to be able to share it with others and really tell them how they can benefit from it is, it's a great opportunity. So thank you so much. Yeah, so Bowen Therapy, it kind of fell into my lap a little bit. Though so lucky that it did. I actually used to, or I still do some, but I was a writer, and I happened to go to a networking event and met a lady there who was a nutritionist. And as we talked and chatted, it came out that she actually needed a write-up done about this type of massage she said was at her clinic that not many people knew about, and she needed a write-up about it. And she asked, would I be willing to go in and have a session for free and do a write-up about it? And I'm like, okay, why not? Sure. So I went and was simply put, because I truly haven't been able to find another way to express what it was like for me. I was truly just blown away. I couldn't believe how these simple, gentle moves could have such a profound effect on me. And because of that, it stayed with me, not only physically and, feeling better, but just in my mind, just saying, wow, like, this is amazing. And I just knew that I wanted to offer this experience to other people because it affected me so much. So yeah, that was my introduction to Bowen Therapy.
That's awesome. That is really, now you got me more excited. Like I wasn't excited enough before to know. That's fantastic.
Mm-hmm.
Okay, so let me just take a really quick moment. Just going to pull it back for a second to do my usual practitioner's moment. So I am an ART practitioner, and I do teach ART, and I like to spend a couple minutes just talking practitioner news. So one thing, and another reason I do this is not just for my practitioners, but I learned a lot about ART through talking to other practitioners of other modalities. So I believe you can learn a lot from what other people are doing. So the tip for my practitioners is understanding the difference between a disconnected energy and an energy dissonance. So we do a lot with chakras, and it's actually pretty fascinating that energetically we can be disconnected from our chakras. In fact, we can be disconnected from any form of energy, any other energy. So when there's a disconnect, it's like we don't recognize it. It's like we don't even see what it is. We don't know how to deal with it. I was working with a few people who lately who had a disconnect with time, where they just seemed to lose track of time, and they didn't have a real grasp of time. They're always rushed, or they always felt like time was getting away from them, or whatever. It was like they literally they had no concept of it on an energetic level. So when you're looking for, so this goes to our relationship energies. When you find that there's some sort of discrepancy between your energy and something else, the first thing you want to check for is a disconnected energy, and then a dissonant energy. So disconnected is like there's a wall between you and that other thing. You really don't recognize it. You'll be able to see it in the kinds of symptoms that people are experiencing. And then there's a dissonance where it's like, yeah, I sort of know what it is, but there's no free flow. It's not really an optimal relationship with that energy. So like I said, it can be a chakra. It can be something tangible. I was working with somebody who despised bananas, like literally bananas. We're talking the fruit. And it was so bad. I actually checked, and it was like, yeah, there's a disconnect between you and that energy. It's just like, get me away as far as I can from that energy. That's a disconnect going on. And so you go from disconnect to dissonance so it's a stepwise process. You can't fix a dissonance if there's a disconnect. So just bear that in mind, and keep an eye out for it when you see people and how they react to certain things. just keep that kind of stuff in mind, because it's pretty fascinating to see what's going on an energetic level. So that's my practitioner tip, or my practitioner moment. Now we're going to reel it back in, and we're going to go back to talking about Bowen therapy. So that again is our topic for today. I'm super duper excited, because that's one of the things. This is a therapy that helps with pain, and one of the things that ART can do a little, like, can work a little bit of pain, but not to the same degree as I understand Bowen therapy can do. So I'm looking to learn more about it and see what I can steal from it. That's what I do. I pick up stuff from other places. So yeah, I am super stoked to hear what Monique has to say today, and we're just going to get on started. So Monique, please tell me, what exactly is Bowen therapy for all our viewers, and mostly me?
So Bowen therapy is a very gentle muscle rolling technique. That's the best way that I've learned how to explain it. The modality out there that most people will probably be able to most identify it with would be massage, though it is very different than massage. There's a couple main differences. It's meant to be very gentle. In Bowen therapy practice, less is more. Because really we want the body to focus in on what's going on, right? On the issue going on in the body. We want that focus to go there, so then the body knows, it doesn't get confused with a whole bunch of messages. We ask it, we direct its attention to the area that's of concern. So then the body really is able to do and focus on what it needs to do to heal whatever's going on.
Okay. So how exactly does it work? Those are very general terms. So can you be a little more specific now?
So where we work is we specifically work in areas of the body, and not necessarily that we only address these areas, but where we work is very rich with the nervous system. Mm-hmm. And when we do our muscle roll, it creates like a vibration in the nervous system. And that vibration created is sort of like shaking out the dust out of a carpet, right? Okay. Or let's say, or strumming a guitar. Mm-hmm. That vibration that's created, it's what resets the communication between the nervous system and the rest of the body. So if I go back just a little bit to lead up to what I just said, when there's an issue going on in the body, because Bowen, while it's fantastic for pain issues, I don't want to leave the message out there that it's only for pain, because it is for many, many different things. Respiration issues, digestion, just so many different things can be addressed with Bowen. But what happens when those issues come up is that something has caused there to be a miscommunication or a confusion within the nervous system. So if you think of the body like a computer, and the nervous system sort of like its motherboard, mm-hmm. right? So the motherboard of computer is where all the messaging goes through to say, like, you click the mouse, and there's a message that goes through the motherboard mm-hmm. to go to the file or whatever area to pick up whatever you clicked on to say, okay, I want to open this. Mm-hmm. Well, the nervous system is that for the body. So if something happens in that communication gets mixed up, then that means when you click the mouse, nothing's going to happen, or the wrong thing's going to happen.
Wrong signal, yeah, it's going right? Wrong path.
Exactly. So when we create that vibration in the nervous system, it's like pressing the reboot button on a computer. Because what does every IT person say?
Yeah, reboot. Yep.
Reboot. Reboot. Exactly.
First thing you do.
Yep, you reset the computer. So that's what Bowen therapy does with the body. Yeah, that's the best way to explain it.
Pretty neat.
Yeah.
Okay. What All right. So you said there's a bunch of things that you can do, like pain, digestion, all that. How many treatments or sessions or whatever does it usually take? Like, I'm sure it's different for each condition, but how, you want to give me a little range, what people can expect before they feel some relief?
Sure. So you'll know whether you're going to respond to Bowen in the very first treatment. You'll know that doesn't necessarily mean things will be treated in the first treatment.
Yeah. You don't expect miracles, like not for any of us.
But you'll know whether or not it's something that you think will resonate with you, will work for you within the very first treatment. What we normally say, though, is we always recommend doing a week in between treatments. And we say do 3 treatments once a week, and then wait 2 weeks and see where you're at.
Okay.
Yeah.
So you usually give it 3. Yeah. And then you'll know if there's like a pretty good improvement in whatever it is within 3 sessions.
Yep. We'll see. Yep. Exactly. We'll see where you're at. See, if the body, because a lot of times
responding to it or not. Yeah.
Exactly. And a lot of times what happens, it's almost like the layers of an onion that you're peeling back, right? So one week you'll focus on so someone will come in the first week and they'll say, let's say I have a shoulder issue going on. And so I'll do work on the shoulder. But what happens is if your body has, let's say you've had an initial injury, let's say on your ankle, right? Your body is like a piece of tissue paper, right? And if something's wrong in one area, it pulls, right, on another area.
Yes.
So, right? So when there's an issue, like I said, in your ankle, then that can actually translate all the way up to your shoulder.
Right.
So while you may be coming in for a shoulder issue, in the end, it's actually going to guide me over the course of a couple of sessions to say, really, the ankle, that's the problem. And once we address the ankle, that's when
the magic happens.
The true magic happens. Yeah.
That's awesome.
Yeah.
That is so cool to know. Okay. Okay. So what, you've described a lot of stuff. We had some questions laid out. You've gone through a bunch of that things, like what makes it different from massage therapy and some of the benefits. So just if you could elaborate on the different kinds of conditions that you work with, that would be pretty cool.
Sure. So it's so many different things: knee, ankle, back pain, hip pain, shoulder pain.
So the whole range of pain.
Yeah, a whole range of pain. For me, the big thing, I'll step into that in a second. But the big physical thing that Bowen Therapy has helped me with is headaches. I used to have 24/7 headache. Literally, there would be one level of headache or another. It was always some sort of nagging feeling there. And sometimes it would get so bad, though, that literally nothing would help. The only thing I could do is go to bed, put a blindfold over my eyes, and sleep, because that was the only thing that would make it better at all. I'd be sick to my stomach, everything. Really horrible headaches. And with just a few sessions of Bowen, I don't get headaches anymore.
That's awesome.
Yeah. It's really
it's so cool.
We do a lot of work with headache work, TMJ issues, and that's actually where a lot of my headaches stem from, was the TMJ. Sure. These 2 joints right here. Not everyone knows.
So people who grind their teeth and stuff like that, it can work on that too?
Yeah, exactly. Actually, I have advanced training for TMJ work because it's really remarkable. These 2 joints are so important in the body, and most people don't even know about that, how important they are. If you think about it, they play a key role in many of the fundamental things that we need to do as humans, right? We need to be able to eat, we need to talk, we need to be able to breathe, all those things, right? And yet, they're so delicate in that they can really go out of joint so quickly and so easily, so that if we don't take care of them, it can cause a lot of issues. So
that's really cool. That is awesome. Oh, I'm thinking of all the people that you count now.
That's why I was so excited when I heard there was advanced training for TMJ issues with Bowen. I'm like, I'm so in.
What age range? Like, do you work with kids? Do you work with, like, how young does it go?
Sure, it can go like all the way to babies. There's actually baby Bowen as well, because colic or that kind of thing.
Oh.
For me personally, I mostly work with middle-aged women. That's
your niche. Everybody attracts a certain clientele. That's
exactly
fine.
Yeah.
But wow, okay. So it helps with colic and stuff like that too.
Yep. Yeah, it's amazing. Cool. It can help with colic, TMJ issues, respiratory, scoliosis, sciatica. Yeah, scoliosis. Yeah, because a lot scoliosis is it's very much a muscle thing, right? Like the muscles pull the skeleton out of whack. Right?
And sciatica. Oh wow, this is fantastic. Yeah. And now we had this is something you'd mentioned earlier. There being an emotional connection, because energy work, it's all emotional. Down there, it's always something emotional underneath it. So how does that play into Bowen therapy?
Sure.
What people experience on the table, because I know with massage therapy, even that can be a form of energy, like just like releasing stuff. I've talked to massage therapists who say, as they're doing it, emotions just get like literally released from their body, and they can either go into like a rage, or they can go into sobbing fits, or they can get like you don't know what plug you're going to open up and it's pouring out of them. So what kind of experience do you have with that?
Sure. So what happens with in terms of the emotions in the body is when you have a traumatic experience, and we have to remember that something traumatic for one person may not necessarily be traumatic for another person, right? So we need to first step back and redefine what trauma means to someone, right?
Absolutely.
So I just want to make that note, because I don't want to, when I'm talking about this, I don't want to make it seem like it has to be this really horrific, let's say, car crash or something.
Right. No, it can be something like a kid didn't get picked for their basketball team.
Exactly.
For a kid, that's this huge thing, and that gets stored as trauma. So it really, I get it. I know what you're talking about for sure.
So that emotional aspect, or that emotional situation, it gets sort of tied into the muscle in the body. And what happens is that emotion being tied to that muscle, the muscle kind of gets locked in that emotional state. And so when you either release the emotion or you release the muscle, it releases the counteracting.
Yeah, they both.
Exactly. They both.
One or the other. Yeah,
exactly. If you think about it, there's kind of this piece of advice that's been floating out there a little bit for people like to help themselves with confidence when they go to, let's say, a networking event.
Oh, right.
And it's kind of like when you
Superman pose, or the pose or whatever. Yeah,
exactly. When you stand like Superman, right?
Yeah.
And it's the same sort of concept. When you stand like Superman, all of a sudden you start to feel comfortable. Your confidence starts to build because your body's in that confident mode.
Yes.
Is put into that confident position. So it
energy or whatever.
Exactly. Yeah. So your body attaches emotions to even your body position, right? Like your mind and everything attaches emotions to that body position. So it's the same thing with any trauma. Yeah. It'll attach the muscle, and once you release the muscle, the emotion comes out. Or if you go through the emotion or the mind, that muscle will finally release.
Okay, I have a kind of almost off the wall. I don't know if you wouldn't be anticipating this one, but I don't know if it's something that you ever get to see. Do you know anything about Louise Hay? Like her.
Oh, there we go. You're back. Okay.
Did you hear me through that? I know you froze, but I don't know if you.
Yep. I didn't hear you. No,
Oh,
you froze
okay.
for a second, but okay. Okay.
Okay. Do you know anything about Louise Hay?
Yes. Oh, yeah. Yeah.
Okay. So I just wondered if you see the same, um, the associations with the different body parts and the different pains and all that kind of stuff. Yeah,
Yeah. Yeah.
it does
Yeah.
confirm that kind of stuff for you.
Yeah.
So like that ankle pain would be joy, right? Not experiencing joy or something or other like that. And shoulder
There's so
pain,
many of them. It's hard to remember.
yeah, shoulder
Yeah.
pains about feeling burdened,
Yes.
and
Yeah.
back pains, depending on where it is not feeling supported. So
Exactly. Yeah.
you
Your
see all
hips are
that.
very much about your foundation, about your being solid and feeling supported. Yeah. Yeah.
Yeah, so you see all that same stuff. That is so cool. I just want to throw that in. I love seeing how those um, the body talks, and it
Yeah.
talks in very consistent
Yes.
messages.
Mhm.
And I just yeah, that's just super fascinating.
The body's an amazing, amazing tool if we
Really
learn
is.
to quiet our minds and listen to it.
Mm-hmm.
Yeah, yeah, yeah. It's really an amazing thing.
Okay. Was there anything else you wanted to add? Because I think I think we really did a good job covering bone therapy. I'm
um, Let me think for a second. Is there anything else? Um, no, I guess that's pretty much it. I guess the key things to think about when it comes to healing and Bowen therapy is that it doesn't need to be a forceful thing, right? It doesn't need to be this huge like forcing the body into to healing, right? The body responds to very light um, um, uh, reminders, and
yeah.
that's all it is. It's just like I said at the beginning, the body's just a little confused, and if you can remind it of how it's supposed to work, it's going to snap it up like this and absorb it and go, oh right, this is how I'm supposed to feel and work. So yeah, so enjoy going and trying those things that are just little gentle reminders, because those are can be very, very powerful techniques.
Very cool. So, one last thing before we sign off, would you tell us how to get in touch with you? Like, if someone wants to have a session with you, you didn't mention that where they would find you. This is not something you can do over the internet, so you got to be local.
Right. So I'm in Mississauga, Ontario. And my website, if you want to, or my company's name is Healing Points Body Therapy. And my website is www.healingpointsbodytherapy.com. So you can reach me there. And I even have an online booking site right there. So it's nice and easy, just a few clicks. Yeah.
Okay. What kind of pricing does it cost to have a session?
Sure. $89.
That's
yeah.
per session?
Yes. Yeah. Yeah, I have package deals as well, though, where you get so many, at a reduced cost too.
Okay, very cool. All right, well, I think that's all we wanted to cover. If you missed if you missed Monique's contact details, I'm going to have that on the YouTube site after we've aired this as well. This is also going to go on my website, where I'll put that contact information in there also. So yeah, don't worry if you didn't catch it. It should be underneath. It should be posted right underneath. So I think that's all. Thank you so much, Monique. I really, really appreciated you sticking through and finally getting to teach me something about Bowen therapy. And
thank you so much, Renu, for having me. I really appreciate it.
All right. So I was going to announce on the show, but still an announcement. So because of all these technical difficulties, as you've been seeing me have over the last little while, this is my last show for a little bit. We're going on hiatus while I find another platform that'll allow me to do this live without without all the technical glitches. So thank you so much for hanging out with me for these 4 or 5 months now, and I hope to see you when I start up again. So take care, and we'll see you soon.